Welcome back to The New Norm. I'm Dr. Lou Graham. This program is brought to you by Midway Dental and Catapult Education. Today, it's about really products. We've been getting a ton of questions about products, and I know we're in this COVID pandemic. And so a few weeks ago, I'm talking to my buddy, Peter Auster. Now, Peter Auster is part of Catapult's Education Speaker Bureau, a great guy. Little tidbits you never know about people. Peter goes to Jamaica for the last 11 years doing a volunteer organization. Peter has been he's like the former past president of the New York Cosmetic Association. He, for 8 years, was involved in the AACD, really the dynamics of running the organization. He is truly a GP's GP. He's just a super guy. He's been part of Catapult a number of years and was a great addition. So when I talked to Peter, Peter said, there's so many key products we could talk about that relate to the COVID pandemic. And I go, talk to me. He starts reeling off all these things and I go, stop, we'll do a program. That's my intro. So Peter, welcome to the show. It's great to have you.
Thank you, Lou. Hey, nothing's really changed since the last time we saw each other, huh?
Now I'd say not much of a change at all. And when I look at where we're at, Pete, and first off, are you doing? I think you told me your associate's going in for emergency care right now.
Yes.
Okay.
She's decided I'm the old man, so I get to stay home.
Okay, I guess I'm not that lucky, but I've got a great team if they're watching, so I got to be careful. Okay, so Pete, let's go right into this. Let's talk about dental products in the pandemic era of the new norm, so to speak. So why don't you start going with what you want, and I'll kick in my thoughts and conversation as you go. Start with your number 1, 2, and 3.
1, 2, and 3. Well, there are three, actually now 4 things that really changed the way we do dentistry these days. One of them is safety, of course. Another is efficiency, and another is speed. And the fourth is economy, because patients are coming in with less money, and frankly, our offices are coming in with less money.
Right.
So when you add all those things together, you want safety for patients and staff. You want efficiency because you want products that work simply with less steps. Economically, of course, you want things that are going to work out for both patient and staff. And speed is interesting because I've never gone for speed before. I'm a cosmetic dentist, and cosmetic dentists don't want speed, but now you need speed.
Right.
Because we're wearing all kinds of stuff with the masks and the shields and the head covers and the foot covers. So we're awkward, we're uncomfortable. We want to get the patient in, get the patient out, but do quality work at the same time.
Got it. Okay, so let's start with then, I know we were talking rubber dams. Talk to me about rubber dams.
I hate rubber dams. I've hated rubber dams from the first minute I ever used one back in my days at Penn. I'd avoided them for the last 30 years pretty much, except for root canals. But now we kind of need them because it's the thing that stops aerosol contamination probably more than anything else. But I still hate the rubber dams. I hate the clamps. I hate the frames. But I discovered something called the Optradam Plus, made by Ivoclar Vivident, which is a pretty cool instrument. It covers the lips and the cheeks, it covers the tongue, it doesn't need a frame, and it's got kind of thickened material around the margins that cover up the lips and the cheeks. So it's awesome, and I'm actually starting to enjoy using rubber dams, believe it or not.
And let me ask you this, is that primarily in the way you use it, because I'm still a clamp guy in the posterior, do you feel good with it in the posterior also? Just curious.
Second molars, I use clamps.
Okay.
First molars, usually I can get away without it. Anteriors, you can definitely get away without it. Yeah.
For sure. And that's made by Ivoclar, correct?
That's it, made by Ivoclar.
Okay.
Now the other product, should I go on?
No,
okay,
keep going.
All right, well, the other product that I've discovered, or I shouldn't say that, my hygienist discovered, is something called the Optradam Plus, which is a product that is also made by Ivoclar Vivident. And what oh gosh, I just blew that, I'm sorry. Help. What do we do here?
Don't worry about it, just keep going. Stop it.
I'm sorry. Sorry, the other product is called the Pure Vac, made by Dentistry Salona, and it's a product that my hygienist absolutely loves. It's a way to turn your low-speed evacuation system into a high-speed. What you basically do is you attach it to the high-speed line. It's a mirror that has suction involved with it also. So it'll cut down aerosol by about 90%. It has a fog-free mirror, and you can basically do the dentistry one-handed. So it's great for hygienists. It's good for dentists, but it's terrific for hygienists, and she loves it.
So let me just say, Pete, we've just got our first one into the office, the Dentsply Pure Vac. I've had Amber Auger on the show. You and I couldn't agree more. I consider it's either you're going to have to literally hire an extra assistant to work with your hygienist or have the floater in there. This is a great system. I absolutely love it. And I know there are other systems on there. I haven't tested them, so kudos. I definitely love the Dentsply Pure Vac. Okay, let's pick another product. Go to another product that you love right now in COVID times.
Okay, well, there's a product that's brand new. It actually was released about 3 months ago. It's called Lux A Crown. It's made by DMG. Now, which of these qualities does it have? Well, it has speed, it has efficiency, but it also has economics. So what it is basically is a semi-permanent crown. It's not a temporary crown, but it's made the same way the temporary crowns are made. So it's wonderful for phasing cases if patients can't afford the rest of the work. Even if they can't afford a single crown, they can put these in. It can last up to 5 years. There's no other product like it on the market at this point, and it works just like the temporary crown materials we always use, which is great because it doesn't change any of the technique that we use, but it works better and it works longer. And it also comes from the line of products from DMG, which include the Lux Temp, which of course is one of the better temporary materials on the market.
So let's talk about Lux A Crown. So I've been using it. It has been out, I think it was launched in 19, I think, because I've been using it now about 6 to 9 months at least. And I would tell you, I'm just gonna go frickin' frack with you on this one. I think this is a must-have in your practice. So I use this when I'm doing a lot of interim implant work. So I use this on a lot of times on my temporaries for my implants, serial extraction cases, and geriatric cases where they, it's such a bad tooth, I don't know how long it's gonna last, or the patient's 172 years old and I really don't wanna do a full crown on them. I love this product, and it squirts in places just like a normal temporary material, right? In your hands.
It's great, and I started using it a lot right before the pandemic really took hold, and I'm so glad I did, because I've got patients that have been at temporaries for 3 months already, so it's great.
I showed this in my geriatric courses, and people go, well, why wouldn't you use it as just a normal temporary? You can, but it's an increased cost. That's not a negative. I charge people differently. So what do I mean by that, Pete? If I was doing temporary implant crowns and I was having them lab fabricated, there was a lab cost. Now I don't have that lab cost. Geriatric crowns, I'm not charging a temporary crown fee. I could be charging $400 or $500 or $600, but it's not $1,200 or $1,600. So I mean, yes, there's an added cost, but the polish, it's just kind of a long-term amazing temporary crown, and in this era I think it's got great validity.
Yeah, there are a lot of codes you can use too. You can use the 2932 prefabricated resin crown code. You can use the provisional crown code of 2799, or you can use it as a 5-surface temporary if you want. Whatever code works, a 5-surface composite, whatever works best for you.
Oh, that's interesting too. I didn't know that. Yeah, interesting.
Yeah.
Okay, so we've covered Optrodam, Pure Vac, Lux A Crown. Okay, let's go to number 4 on your list. What do you love?
Okay, well, these are composites and cements. Now, anyone who knows me, and I know you know me, Omnichroma has been my sweetheart for the last 2 years, and I've been using it right from the beginning. It's a single shade material that uses something called structural color as opposed to chemical color, which means it takes on the color of what's around it rather than bringing its own color into the tooth. And it's amazing. It takes away the choice of having to bring in 37 shades of a material. You just have one. It eliminates a lot of expense because you don't need those extra shades. It
Right.
polishes beautifully. And one thing that I'm learning about it, because I'm testing it for the company now a year later, it looks fabulous a year later. It changes color as the tooth does. So I don't know if you knew this, but if you whiten the tooth, this whitens with it. If you darken the tooth, as the years go on, the tooth darkens, so does this. So it's still going to look as much as the color of the tooth 5 years from now as it does now. Pretty amazing stuff.
Wait a second. How does that work? How does it lighten when you bleach a tooth?
It pulls in what's around it.
The color.
Which is, yep.
Wow. And now,
So
so Pete, let me ask you, is that 2 millimeter increment, 3 bulk fill? How's that work for you?
it's 2 millimeter increments. Yeah.
And you work with it in the anterior and posterior, of course.
I do. I use it all over the mouth. It comes with something called a blocker. So if you really need to block something in the front of the mouth, you add the blocker with it. But I don't use it the rest of the time. And I find that it's amazing. When I'm taking off old amalgams, even if there are amalgam tattoos that are still there, even if the tooth is black underneath,
right?
Sometimes you use a little blocker over it, add this material on top. It's spectacular.
So can the blocker be like a 0.5 millimeter or a millimeter, and then you layer over that? Is that what you're talking about?
Correct.
Okay.
And the one thing it's better at than anything I've ever used is if you're using making an implant crown.
Yep.
And you've got a screw hole you have to cover up. You add a little bit of blocker over the screw, you add the material over that, and it's unbelievable. And it looks like it's a brand new crown that's never been touched. You can do the same thing with post holes. Nothing I've ever used is like this before. It's amazing.
Okay, wait a second. So you're telling me that I've done my endo through a zirconia crown or an Emax crown, because it happens, it happens. You're telling me if you put a little blocker and then this, so you bond the access opening, and now you put a little blocker and this, it basically adapts virtually, even with the PFM. You don't get that gray look to it? Is that what you're telling me?
Not at all. The gray is gone.
Okay, everybody out there knows that gray, so that's a great pearl. Yep. That's a great pearl. So Pete, I got to go back to it. So if you're blocking out, can this be? Is it too blocking, like as a dent in color in the anterior? I'm just curious, or if it's just a class, let's call it a class 3 in the anterior that's from the buccal. Do you not normally use it? You would normally just use your omnichroma color?
The interesting thing about the blocker is not there to block out a dull color, a dark color tooth. The blocker is there to black out the color of the rest of the mouth. So in the front of the mouth, what other colors in the front of the mouth? Pink.
Right.
So you're using the blocker to take away the possibility of reflecting that pink. But you can also use a small amount of it to block out black. I use it a lot more in the blocker, a lot more in the front of the mouth than I use it in the back. I find most of the time in the back of the mouth I don't need it.
And is the blocker a flowable, or is it more of a composite feel?
It's a composite feel. It feels just like the omnichroma.
Okay, fine. So it's a composite, not a flowable, right?
Correct.
Okay. So that's your composite of choice. Great. Flowables. Let's talk flowables, because I'm a big flowable guy. Talk to me.
Well, I was told that I can't call these guys flowables. You have to call them injectables. And they're injectable composites. They're made by GC, which is another fabulous company. Both of those companies, you get GC and Tokiyama, both from Japan, and they're both wonderful companies, and they just come up with great stuff. So they have two flowables. They have the injectable flow, and they also have the universal injectable.
Yeah.
The injectable flow you can use with as any kind of flowable composite that goes deep into the tooth itself, and you can get a 4 millimeter cure. Then there's the universal injectable that you can use any color with. It's a high density resin. Both of them have a silane coating on top of the resin, which gives it a great look to it. Polishes beautifully, and the polish lasts for a really long time.
Yeah.
And I gotta tell you, these are the only flowables that I really love these days. They're great.
So you're keeping your real, so when your assistant has to set up in a COVID restorative case, you're really keeping it relatively simple with, your Tokiyama product and your GC America product, so to speak. Would you agree?
That's absolutely, yeah.
Oh.
And if you really want color, you want everything to look something beautiful, I'd go with the Omnichroma. But if you want something that's going to work well and fast and speedy, the injectable products are fabulous.
Okay, so if we're talking flowables, talking composites, now we got to talk about light curing. And this is curious. Just talk to me about your light curing approach.
Well, these are Ivoclar products. I happen to like their lights a lot. So they're the blue phase lights. There are a number of them out there. The latest one is the Power Cure system, which is very, very cool because among other things, it's a 3-second cure. And they're coming out with different products that will be able to be cured with 3 seconds. Not all products, but 3 of them right now. Adhese Universal, which is one of my favorite bonding agents, Tetric Power Fill and Tetric Power Flow. So the light is a high intensity light. It is 4 different curing times depending on what the product is. It's very, very automated. It has a light meter on it to make sure that you're getting the right amount of light from it. And it's weighted beautifully, which is what I really love about these lights, is how well it feels in my hands.
Yeah, I would tell you, I think the light itself is probably, Pete, one of the most valuable tools. And, look, this is an open dialogue. Catapult Education works with 100 companies. And the beauty is Pete Auster can like X, Y, and Z. Sam Hallibo can like X, Y, and Z. Jeff Horowitz can. And this is how we all kind of work it, because all doctors have their own little favorites. And that's why this is just great to have you. Because I think the light, if you use a bad light, like I've been a Velo guy forever, if you use a bad light, your composite dentistry is just not going to last. You're going to be dealing with micro leakage. And I think specific curing and specific curing times, like you're talking about, become, really, it takes the guesswork out of what we're doing every day. And I think you would agree with that.
Oh, sure. That's the beauty of working with Catapult, because we get to try everything. And I've tried so many different, and these are the products that work well in my hands. Now we're going to talk probably about cements in a couple of minutes, and one thing I'm going to tell you is that over the past 6 months of working with new products that have come out, it has completely changed the products that I use for cementation. Totally.
Okay, so let's talk Catapult. Cements that we've reviewed that you have fallen in love with. What do you love?
Okay, all right. ZR Sem, I am madly in love with it. I go home and actually I have a box around here someplace. But
wait, Pete. I don't want you to go home and talk about stuff. Let's stick with the cement. Talk to me about, what are you talking about with ZR Sem?
Oh, do I have to? ZR Sem, it's made by Premier, which is not a company you necessarily think of as a cementation company, even though they've had the Premier implant cement on the market for years. ZR Sem, I said, all right, just one more cement. They're all the same. No, it's not the same. It's great. So it's a very easy cement to use, and it has a very high bond strength to zirconia, and it's actually proven by other valid studies as opposed to the company studies, which means a lot to me. It has 10 MDP, which means you don't have to add Monobond Plus or one of the other agents. It's dual cured, but here's the best thing about it. You use a 2-second cure on each portion. It says 3. I like to use 2. In each spot, mesial, distal, all around the tooth. It comes off in one piece. It's amazing. And in this day and age where we want speed, sometimes the hardest thing is getting that extra cement off. And if you can get the extra cement off in 5 seconds, it's fabulous, along with the fact that it's also a great product.
Agreed. I mean, Yeah, it got great. That cement got a great Catapult review. It was very well loved. Agree.
Yep.
Okay, on your list that you provided me, we have one very common love. It's your laser of choice. Talk to me quickly about your laser of choice.
Oh, that's it. Oh, now we have to talk in private because I love this even more. So this is the Gemini laser, which is first of all, it's sexy. It's the only sexy laser. It is gorgeous.
It is sexy.
It's this clear thing, and you turn it on, and it does fabulous things. It's amazing.
Yeah.
Anyway, what it does is that it's a dual wave laser, which means it has an 810 mode and a 980 mode, which means there's less charring. It cleans very well. You clean the tissue off. You take a look at it a day later, it looks like nothing's happened. It has very, very few post-op issues. I've used it for all kinds of things. I've used it for frenectomies. I've used it for removing abscess ulcers. But the major use that I use it for are class 5 areas and also some minor crown lengthening spots. And it works beautifully every time. The most important thing about it in this era right now is that it's got tips that are one use. They're all ready to go. It's fabulous. They're pre-initiated, and pre-initiated is like the best thing that's ever happened to lasers.
Yeah, we love it in our office. We have two. One, the tips can either come pre-initiated or non-initiated. Like my hygienist, we use it in a decontamination mode all day long. We had Kaminer on, and he loves it for tissue troughing before he does his crown impressions. So versus cord, he's a trougher. Now this is that laser also is a huge home run amongst the group. I know a lot of us use it in the group. We do love it. Okay, last product, because I'm going to cover all of them for you, was your crown remover. You got 1 minute, go.
It's this big, huge thing. It's like this big. I mean, you have to. Let me show you. You have to carry it in. It's like you bring it in on a boat.
Right.
But it's big. No, seriously, it's about this big, and it gives you leverage to take off crowns that you never were able to take off before. So if you need to take off an old implant crown, if there's a screw loose, or you have a screw loose, whatever you need it for, it gives you terrific ability to take a crown off that you may never have been able to take off before.
And so who makes that?
It's made by Miltex.
Okay.
It's called the Miltex Weinman Crown, and it is sold by the company that's sponsoring this beautiful thing we're doing today.
Okay, so wait a second. So what's the learning curve on that? Is it a hard learning curve? Is it a video and you're ready to go?
It's about 7 seconds. You just know it. Just the same way you leverage a tooth to take it out, you can leverage this to just gently remove the tooth itself, the crown itself.
So the biggest fear, of course, is the doctor's going to break the tooth off, like the entire crown, and it comes off with the crown itself. Doesn't happen routinely. Is that what you're telling me?
Hasn't happened with this. No, because I think it's the amount of leverage, the amount of weight. It's actually a bulky product, but in this case, you want bulk.
Love it. Miltex Weinman Crown Remover. Pete, that was the fastest 18 minutes of my life. I miss you. I know we may not have our Catapult retreat this year. Hugs, and I can't thank you for being on the show today. Really, thanks so much.
Thanks for having me. Appreciate it.
You got it.
Take care.
Take care. So let me be clear. We want to hear from you. We want to hear your questions. So what we want you to do is we want you to go to education@midwaydental.com. Shoot us your questions. We'll go right to the experts. I know I'm not the expert, so let's go ask the experts what we should be doing as our next step next week, the week after, and thereafter. I look forward to hearing from you.